know a lot of people my age are trying to figure out what we can do now to make our lives easier in the future. So Jenny, my question for you is, what can clients do to prevent, say, having to do a whole lot of procedures all at once?
I would recommend skincare first and foremost, because you want to make sure your skin's always clean. You want to make sure you're putting on good moisturizers, good sun protection, and keeping it moist and looking youthful. So skincare for sure, because I have patients that come in, they do their Botox and their fillers, but then they're not doing anything that's nice to their skin at home. They're buying things from cheaper drugstores that aren't really having any activating ingredients in them. So I really stress the medical grade skincare, because you're going to have the AHA, which is alpha hydroxy acid, that cleans off the dead skin cells. You're going to use a really good sunscreen so that you're going to prevent the brown spots from happening. And later on, they kind of creep up on you. So if you've been a tanner, in your 20s and 30s, going away all the time, Mexico, Cuba, then come like your 50s, you get like the brown spots on your chest. You get like a map on your forehead, which a lot of patients are telling me that it feels like they have like a map on their forehead, because from, tanning from when they're 20, so they have like a blotch here, a blotch here, and a blotch here. We do have the Peak Away that takes that away. So, but I mean, why go through that? Why don't you protect your skin now so that you age gracefully? I know everybody knows about Paris Hilton. She lives in California. She's in sun every single day. She listened to her mom, wore big hats, wore sunscreen, and her skin looks amazing. So that's what I always stress to my patients, to always start with really, really good skincare. And so you always want to make sure you're using a good sunscreen, something with vitamin C in it, AHA, and retinol. So yeah, skincare first and foremost. And then when you're doing a good routine at home, I like to suggest something non-needle first. So maybe chemical peels, IPL, or maybe a sublative laser. And then if they still have like some fine lines forming, that's when I start suggesting Botox. And when they start noticing loss of volume, that's when I start suggesting fillers, because that's where you need a hyaluronic acid injected into the areas that you're losing volume. And that's when you need Botox to stop a muscle that's scrunching so hard. When the 11s or the crow's feet are scrunching all the time, you're going to cause those permanent lines to form. So when you're younger, you don't need as many units as you would if you started later on, like past 50. So that's what we promote here, is the prevention and doing little bits, a little bit of the time, so you're not all of a sudden waking up and being like, okay, I need a facelift. So we do all those little things as we age.
What Jenny said is really, really wise, because I see patients coming to see me all the time. They come, they want to have a facelift, and I say, okay, so how are you taking care of your skin? And well, I use Dove or something, right? Like I don't do anything. It's like going to your dentist and you want new teeth. You need something fixed, and you never brush your teeth. Skincare is like taking care of your skin is like a pyramid. So at the top of the pyramid, at the very sharp part of the pyramid, that's surgery. But it's a little tiny part at the top. That sits above everything else. So at the very base is skincare. If you're not doing skincare, don't even bother doing Botox, because you're not brushing your teeth. So at the bottom is skincare, and that's what Miracle 10 is all about. And then the next point up is skincare in the clinic. So that's peels and things like IPL, so non-invasive treatments. And then the next stage up are the more aggressive things, the lasers or the RF technologies, the other technologies that we have above that. Next point up are the injections, so Botox. Next point up are the fillers. And at the very top is surgery. So now we think of surgery last after you've been doing everything else. And that's what makes your skin look really great. Because we don't want to have you have tight, pulled, wrinkly skin. That doesn't look good. We want to have you have beautiful skin, and we can always do the facelift at the end.